It's the Bobby and Paul Show. The Bobby and Paul Show.
Okay, let's check and see that.
Can anybody tell me what's going on? Tell me what's going on. If you open your eyes, you'll see that something is wrong.
How are you?
Good.
How have you been?
I have to admit, I have not been all that well lately. I think it's evidenced by the fact that it's been 3 weeks or 2 weeks. When's the
2
last?
weeks.
It's been 2. We missed 2 weeks.
Yeah.
We've missed 2 weeks. So that's right, because I was sick for 2 to 3 weeks.
Yeah.
I have been, and there was a very strong breeze coming in off the lake here. You can see
Yeah.
Lake Victoria in the background, so I don't know how much.
No, that's not a problem.
So, yeah. But I mean, somebody commented that they like the fact that we get all the sounds of what's going on around us
Yeah.
in the video.
More natural setting.
Yeah, more natural setting. So we got.
So you've been sick.
I've been
and
sick.
how do you find our medical system?
The medical system here, well, I love your medical. I mean,
You love it?
there's a stereotype that the medical care is worse in Uganda.
Okay.
And I want to say this by telling you another story before I get to me being sick. When I first came to Uganda, let me give a little bit of history about this. For years, doctors have been giving me medication for a certain problem that I have that I'm not going to necessarily name what it is.
Yeah.
But they've been giving me medication for years for this particular problem. And that's basically what American doctors do, is they treat your symptoms and not the problem. I came here to Uganda to get medication for the same problem, and the doctor says, well, you actually have an infection. I'm going to give you antibiotics to treat the infection. And
Boom.
the problem went away. And I'm like, wait a minute. I had multiple doctors in the U.S. for years, 7, 8, 9, 10 years. They gave me medications for this problem. They didn't even bother to figure out that the cause of the problem was an infection. So I get the antibiotics, the infection clears up, the problem goes away. I've never had the problem since.
Interesting.
So, and that's the difference between Uganda and the U.S. In the U.S., the doctors treat symptoms.
Is it because they don't know the problem, or they're making money?
Making money. Yes, because of the drug industry, they make money. But in Uganda, the doctors here are focused on actually finding out what's wrong with you and solving your problem. And it's better here.
Yeah. Okay.
Yes.
Interesting. And you know that Uganda's labor market, they underpay people. The money they pay anyone in Uganda would look like slavery in the US.
Yes.
And there's a court case right now about a judge in the UK, a Ugandan judge. I don't know if you've seen it. Have you seen it?
No, I haven't.
Okay, so there's this.
I'm interested to hear about it.
So there's this Ugandan judge. She's a UN something judge, whatever, in Uganda. But so she got a scholarship to go to the UK to do a PhD in law. While in the UK, she struggled with. She worked with her children. So while there, she struggled with getting house help because they're very expensive. So she got her house help from Uganda. Now in Uganda, she was paying top dollar for the house help. That's around 100 pounds a month. That's around 500,000 Ugandan shillings.
Yeah.
So in Uganda, that's a lot for a house help.
That is, yeah.
Now she took her there, which is also another privilege because getting a visa to such a place is very hard. And she did all her maneuvering with diplomatic things, and she took her there. Now she said, okay, I'll bring you to the UK, you stay with me and, help me with my children, and maybe after when I leave, you can stay here on your own. So it was like a win-win. I'm going to meet a place you would never have come.
Right.
Anyway. And you can sort yourself, maybe when I'm done with my PhD. So what happens is that she was giving her this money, which is a lot in Uganda,
But
which
not,
is slavery
not
in the UK.
Yeah.
So now someone finds out about this going on, like she was like in the park like this, taking the children. So like, man, people are like wondering, how does this black woman, how is she able to afford to have a house help? So they start asking her questions. Oh, so okay, how is your boss? Are those your kids? No, okay. So you're working for someone, how much are they paying you? And my God, she said the price. They're like, oh my God, that is slavery. And next thing you know, gets led to another and ended up at the police. Now the woman has been jailed.
Oh
Now she has been jailed because of slavery. Like, so it's the way it is. It's a
But
top,
her
it's a top
intention
case.
was not, she probably didn't give it any second thought. She was just doing what you normally do in Uganda.
Exactly.
There was no intent.
Yeah, so the issue is like, okay, I'm going to bring you over to the UK. You're going to stay in my
Right, she
house.
had the best
I'm going
intentions
to
to help
feed
her.
you. I'm going to pay you. Yes, it's meager, you know, per se for UK standard, but I'm taking care of you 100%. And when I leave, you know, you could stay and hustle out
Yeah.
live on your own. But the system there, you know, called her for
Right.
enslaving someone.
That's just the West not understanding the different context of Uganda.
Maybe they understand, but sometimes I have another shade to this. Like, could it be that they're trying to do what Trump is doing, like anti-immigration? So like, okay, if we can reduce the people coming to our country this way, because now, okay, of course it came in an unjust way because they had to
Yes.
manipulate the diplomacy between Uganda and the UK to bring,
Right.
because she
Correct.
came through like a diplomatic pass, something like that. So she came almost like a diplomat, but she was coming to the main. So now, like, okay, so let's reduce the chances of such people coming to our country. So let's make a big fuss of it. It was all over the news, CNN, whatever,
Right.
BBC. The person has been arrested now. So not good for her. But slavery. So how do we get here? I was talking about the doctors. So doctors are so underpaid here. If a doctor is getting around 500 USD,
Right.
and that's a well of doctor, because some even get just like 200 a month. Now, that same doctor will go to the US and they'll probably give that person times 20 of what they're earning here. Why wouldn't they go?
Right.
That's why you find that Uganda exports, is it called a labor drain or something like that, where we find that experts in the country, they keep running away from the country to go somewhere else to make money.
Right.
And then we find that we do not have enough labor here because we don't pay people. So you find that our doctors are actually good, but so since they're underpaid, they keep running.
But here's another aspect to that I think is there's kind of maybe an advantage to that, but a drawback to that as well. Because the advantage of that is that the prices here are very inexpensive. One of the reasons why the prices are so inexpensive when you get medical care is because the doctors are not requiring a lot of money. But if you go to the US, doctors are taking an extravagant amount of money. Like, for example, if you go to the US and you have to go to the emergency and you don't have health insurance, you're looking at least $600-700 just for the visit, maybe over $1,000 plus whatever they throw on top of that. You could be looking at thousands of dollars. If you go to a doctor's visit, just to see the doctor might cost you $100, $200, $300 just for the appointment, not including anything that's on top of that if you don't have insurance. And so the disadvantage on the other side in the US is that the prices are so extraordinary. And many of these doctors, I mean, like you go to the hospital, you're going to get a bill from the hospital, you're going to get a bill from the doctor, you're going to get a bill from the lab. If you had an x-ray, you're going to get a bill from them. And that's kind of the disadvantage of the US, is even though the doctors make money, the amount of expense that is on the patient is extraordinary if you don't have health insurance. Whereas in Uganda, the burden is not so hard. I mean, if you have a medical emergency, it's not going to cost you everything you have to get care.
Yeah, to probably get you a fraction of what you spend in the US.
Yeah, and you will get just as good of care here, and even better care than you will in the US.
Yeah, and they'll probably also like what would cost like say 5,000 USD or 4,000 USD in the medical field.
Yeah, so
would probably-
$5,000.
Yeah, would be around 1,000 here,
Yeah, or even less.
or even less.
Even less.
Probably like 500 or 600.
Yeah.
But then even that, you will still be at a top end place where they will still treat you as a VIP customer, and you still get very good
Right, right. So you're going to get the care, and in my opinion, you're going to get better care here than you will in Uganda.
The US.
Or did I say that? You'll get better care here in Uganda than you will in the U.S. You will pay less, but also the disadvantage here is that the doctors aren't making as much. But also at the same time, you have to keep in mind that the cost of living in Uganda is not very high. So even though those doctors might only be making $500 a month, $500 a month is enough to survive here in Uganda.
Yeah, but like ideally, doctors, the importance that the part they play in this in the society is too great for them to be living as average people.
Right.
Because 500 USD in Uganda is good money, but you will still find someone sleeping in a terrible apartment for that, and they can't even afford to have a car. They can't. Like it's still on the low end for a doctor. At least if it would be like
For a
1,000.
doctor. But you think for the average person, it seems like that'd be a lot for...
Yeah, for the average
Like, a lot of
person.
people around here, they're driving cars, they're living in nice places. They're making... They're not making much more than
They're making
that.
like 1,000.
Yeah, so they're...
Like 1,000.
1,000.
So like 1,000 would be like 3.7 million. So now the average Ugandan, someone who earns that can afford to get a car.
Yeah,
But now if you're earning 500,
it's a little more of a struggle.
you really struggle to get a car.
So if you make about 1,000 a month, you're...
And you'll certainly get a car. Actually, if that's something you're getting on your account every month, the bank will offer you a deduction. Like, oh, you actually can get a car loan. Because they know, because the car is roughly around 15 million Ugandan shillings. That's around roughly, what would that be? That's like 5,000 USD. Yeah, that's the car in Uganda. You know, if they notice that, okay, this person is earning 3.7, that means they can use like 1.5 and they can still pay off the car every month, 1 million.
Yeah.
Which is okay. They can give it a car. But now if I'm earning 1.5, how much are you going to pay for the car? You can't. You're basically using everything. It's hand to mouth. So no one is going to give you that offer.
So I would think that most people around here, like the average person, does not make 1,000. Like, the majority-
That's not an average person.
Yeah.
That's a high-end person. Now, or like at least 2.5 million. That's around probably
So
like
that's why there's so
700.
much bodas and taxis. That's why that's so popular.
Yeah, so most people you see in the taxis and cars, they earn around 500 and below.
Yeah.
So if you
For the
earn,
Ubers, it's not going to cost that much. People use Ubers. And,
Ubers are still not for average people. They're
Yeah,
expensive.
yeah.
And they're expensive because if a taxi is going to take around
two, even like
$1, $2, $1,
$1,000.
$1,
$1.
a taxi route can be $1 or $2, but an Uber will probably take 10.
Yeah.
So at the average person, that's too much money. So you will just use the taxi instead. Anyhow, so that's about Robert's health, and it's good to have you back
Yeah.
and in good
So,
shape.
I could kind of summarize. Like, so how do we summarize? Just by saying doctors need to be making more money, but if they make more money, of course, then it makes the drawback is it makes the expenses for the average person more higher,
it?
like they are in the U.S.
Does it? Because first of all,
It doesn't. You're saying it doesn't.
it doesn't. Because why? Because medical is the must. It's like a basic need. You know, it's not even like it is a basic need, and every once in a while, everyone has to go to the hospital. So basically, hospitals have ready supply of clients,
Okay.
so they make money every time. So
So you're
the
saying they should
problem
just
is
take more of that money and pay the doctor?
exactly because they make more profit. Like you find guys who own hospitals are having mansions and mansions left, right, center because they take all the money themselves. They don't pay well, even when they have the money. So it's not that they should increase on the medical bills for the people that are receiving the services, but they should also have a percentage where like they shouldn't take too much of the profit.
So it's kind of like this idea that we
They are milking the system.
Yeah. So it's kind of like this extreme. We go from one extreme to the other. United States might be one extreme. Uganda might be the other extreme. Because I remember a friend of mine was telling me a story about this doctor who lived in a mansion, and he asked them, "How do you justify charging him these tremendously high prices? And you live in a mansion." And the doctor said, "Well, I saved his life, didn't I?" And it's like in his mind, well, I'm doing this care so I can charge whatever I want, even though he's using the money I don't know. There's just kind of like, I don't know how to find this balance. You know, it's like, because if doctors in the U.S. are living in mansions, they're making enough money that if they reduce that amount, it'll reduce the burden upon patients.
Yeah, sure.
But here in Uganda, it's the other extreme where the hospitals are taking the money, and the owners of the hospital are using it to squander it and live in mansions, and the doctors aren't getting what they need to survive, to live adequately off of.
Yeah, so you find a doctor will be sleeping in a one-room house, no bed, just a bed, and no sitting room, no nothing, and that's a doctor. Whereas I don't think that can happen in the U.S. But doctors earn a lot of money.
No, they earn a lot. No, if you're a doctor,
you're high-end.
Now, the disadvantage, if you try to go to medical school and you flunk out, and suddenly you've got $1, $2, $3, $4, $500,000 of debt that you can't pay off because you flunked out of medical school, and this happens to people.
You don't have to flunk out. That's a choice. That's the other.
Well, you just flunk out. You're not good enough. They dismiss you.
They push you out. I thought like you can receipt the paper.
Well, eventually, let's say you keep doing that, but eventually you decide you don't have what it takes, you're dismissed.
Yeah. And then you still have to pay.
You still have to pay. And this happens to people. I recently heard a story about somebody who's $430,000 in debt because he flunked out of medical school and he's got no medical degree. He can't be a doctor to show for it. So he has to look for other ways to take his education to make money, and what he's done is he's become a biology teacher in high school, which it's not enough money to pay off the debt that he has, and he's not going to make enough money being a teacher to pay off that kind of debt. So he's got to try to find creative ways to use what the education that he has to get a high-paying job.
He should start a school.
Once he goes back to school, he could start a school, you say. Oh, maybe.
Let him come to Uganda and start a school.
Yeah, maybe.
It's actually cheaper to start a school here. You can come start a school, an international school per se, and you get a lot of money per se.
Yeah.
Because we have affluent citizens who have a lot of money, who can pay American standard education here. Can come make a school and make the money. Okay. And that's just off the bat. Okay.
So yeah, Bob, so I've been sick for so let's just wrap this part up. Like you were saying.
So yeah, we'll be back. You can see the healthy man now is
we're back. I'm
looking
back.
weird.
Can anybody tell me what's going on?